Hi everybody, it's Janet Pope here. I'm a room reporter from At Room Now, and I'm here in Milan at EULAR 2023. And if there's background noise, it's because there's a lot of buzz going on today. So I wanted to talk about JAK inhibitors, but in an area where you're not thinking as much about them and they are going to become possible blockbusters. So I'm going to talk about really JAK, upadacitinib. I'm going to talk about baricitinib that we thought already after the negative phase 3 trial had sort of been put to sleep, but maybe it's woken up again. And I'm going to talk a little bit about TYK2. So the first thing, upadacitinib, 15 milligrams a day in active non-renal lupus, was in an RCT, the SLE EK trial. It was randomized to a JAK plus a BTK, which gave no added value than the UPA alone, or a placebo. And the bottom line is upadacitinib is now in phase 3 trials because the outcome measurements were positive. What they are telling us about here is basically POS, a poster 1133, is really looking at the fact that when the patients are in the study with active disease, there is an interferon type 1 signature, a serum signature, and that will be downregulated. Is that because of two reasons? Because when we control lupus, interferon goes down the way it could with glucocorticoids or anything, or is it a downstream because of the JAK-STAT signaling? I'm asking the question, I don't really know the answer, but good to know. Also, we know that deucravacitinib in the Paisley trial is positive. We already know that, it's been reported. So that's looking at deucravacitinib versus placebo added to standard of care in non-renal lupus. What we do know now is that they are also in phase 3, and they also looked at interferon production in the patients and found it was upregulated, especially in the younger, highly active, lots of antibody patients, and that it was downregulated. So interferon is really important, not just in drugs that dampen interferon directly. The final thing that I think is actually important, and it's going to give me pause to think, is that there was a single site study. It was out of Turkey, oral presentation 0053, and it was a randomized controlled trial, I would assume registered a long time ago when the phase 2 and 3 trials were going on for baricitinib. But they're ready to report and are reporting at this meeting baricitinib 4 milligrams a day versus cyclophosphamide in active renal lupus nephritis. And what did it do? It helped renal nephritis and both groups, as it should, but surprisingly, they were about equal. But it also is helping the other features of lupus that cyclophosphamide isn't as good at. So what have we got here? We have a package of a couple JAKs and a TYK2 that might really revolutionize lupus for some patients, where maybe, if these things pan out more, we'll have oral options available for our patients. So please follow us at Room Now and enjoy yourself. Thank you.